This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is Medtalk, your weekly on-air health consultation here on the Solar News Channel.
Despite advancements in Western medicine, there are still those who rely on alternative forms of treatment and medication. One of these is traditional Chinese medicine, or TCM.
Traditional Chinese medicine is oriental medicine used in China. It started way back 2,500 years BC. For the cupping, it's to remove the blockage along the channels. We remove the cold, it suctions the area where there's block. While the moxibustion, it's Artemisia vulgaris. It's a certain herb that when you burn it, the heat penetrates to the channels. So it removes also the blocks and it improves the circulation. Acupuncture, it's when you insert the needles, it stimulates the body to produce certain endorphin.
Ella Osea is 35 years old and she works as a freelance computer technician and a private tutor. She started with acupuncture when she was 21 because of her migraine and dysmenorrhea.
I tried acupuncture. 6 sessions of acupuncture. It really relieves my migraine for about more than a year before it occurs again, but lesser talaga.
Aside from her twice-a-month acupuncture sessions for maintenance, she also takes Bai Feng, an herbal capsule used to treat menstrual irregularities and increase fertility in women. Nowadays, more and more research is being done on traditional Chinese medicine. Some doctors even use these alongside their treatments and medications. Although the method of treatment is quite different from what we're used to, traditional Chinese medicine could be an alternative. How different is traditional Chinese medicine from Western practice? How safe is it? And is it really an effective alternative?
Kung Hei Fat Choi, blessings and prosperity to everyone. Tonight we're talking about traditional Chinese medicine. Joining us is Dr. Francisco Navarro, medical acupuncturist and head of the Complementary Medicine Service of the Department of St. Luke's Medical Center, and Dr. Philip Nino Tangatue, the consultant head of acupuncture services at the Medical City and clinical assistant professor at the UP College of Medicine. Welcome to Medtalk, doctors.
Thank you for having us.
All right, you can join our discussion by calling our hotline, tweeting us and emailing us, and by dropping us a line on Facebook. Again, we'd like to welcome you to the show. Again, Happy New Year. Happy Chinese New Year. Chinese New Year. Please introduce to us what traditional Chinese medicine is all about.
Chinese medicine, traditional Chinese medicine, is an ancient medical system from China. It's been thousands of years old, and it looks at the body in a different way from what we know as modern Western medicine. It's very holistic. We look at so many factors: lifestyle, diet, sleeping habits, emotional states. All that factor in maintaining your health. And then the objective of Chinese medicine is really to promote health, maintain health, prevent illness. Of course, if illness does occur, then we will treat you also.
And how do you look at the body, Dr. Tangatue?
Well, Western medicine focuses a lot on structural problems. So even in microbiology, in whatever field like psychiatry, they're always looking at what receptor needs to be blocked or what part of the body needs to be fixed. in Chinese medicine, there is also emphasis on the anatomy, on the structure, but they emphasize more the relationship between structures. So you might have a normal heart or you might have a normal kidney in Chinese medicine, but if they're not communicating right, it's like they're having a lover's spat, and the whole body can hear the quarreling.
Okay.
Chinese medicine looks at the energy, the function, and how these functions interrelate. So whether both in the internal environment, the different functions of the different body, or different parts of the body, and how you relate with external environment, the internal and external environment.
And if I may add,
Yes, please.
Dr. Kit talks about, what we've talked about so far is the system. So because when people hear Chinese medicine, they think of the modality, they think of the herbs, they think of the acupuncture, they think of the cupping. These things can exist outside of Chinese medicine. You may have cupping in European traditions. You may see these herbs being used in Western traditions of herbalism. But what makes Chinese medicine unique is the system behind it.
What do people not understand when they talk about Chinese medicine? I know that when you talk about Chinese medicine, in your reference to like a lover's spat, it's the balance of the yin and the yang.
That's one way of looking at it. Because, so if we're talking modern misconceptions, I'm glad that you mentioned yin and yang. Because most people, when they think yin and yang, they think of something absolute, and yet, so something must be yin or something must be yang. And they also think about it as, and I think this is influenced by a certain science fiction movie. One aspect is bad, one aspect is good. The truth is, they are just any opposite aspects. They're relative. So what is yin today might be yang tomorrow, depending on what you compare it to. And it's not whether one is bad or one is good. It's good if they're working together. If they are not working together, then that's what's bad.
One misconception is that Chinese medicine is a separate system and should be taken as an alternative for Western medicine. In St. Luke's, we have the complementary medicine service, and we use the term complementary medicine. It's a complement. So whereas Chinese medicine, our treatment modalities can help maintain balance, support your body, fix your habit, fix your lifestyle, you might still need Western medicine, modern medicine, drugs, maybe surgery, therapy, for intervention, for fixing problems, while we support the landscape.
To give an example, in the medical city, our acupuncture service often gets referrals for cancer patients. Why? We're not there to take away the role of the oncologist and the surgeons. We're there to help out. So a common problem would be people suffering from the side effects of chemotherapy. So acupuncture gives you very, very good support so that they have less nausea, hindi sila nasusuka.
Okay.
And after the treatment, after the surgery, we can use herbs to help them speed up their regaining back their strength. Because you often hear this from cancer or stroke patients. They're better, but it's like they never feel the same. They always feel sluggish. It's never the same. But that's what I like to compare it thus. Western medicine is good in bombarding the bad guys, but Chinese medicine can come in and help repair the collateral damage.
Okay. So you mentioned coming in, we have a tweet that just came in. This time from Janice Cruz. Doctors, how do practitioners diagnose their patients, and how is it similar or different from Western medicine? We're already talking about that.
Okay.
Maybe we can add a little bit more for the
Yes.
one who gave us a tweet.
Well, when you go see a Oriental medicine doctor, you'll probably experience something similar. The first thing we do is we ask questions. The difference is we may ask questions that the patient might feel, what does this have to do with my headache? Because we'll be asking questions about how's your sleep, how's your appetite, even your
Do you feel
morning,
hot? Do you feel cold?
your morning rituals.
What emotions are prevalent in your life? Do you have certain cravings or aversions to certain foods?
Or certain tastes.
So we're looking at the landscape. So this is the medical interview part.
And then the next, we also look. So just like, I'll never forget what I learned in UP. We were taught that sometimes the most important examination is watching the patient walk in. Same thing with Chinese medicine. What else do we look at?
There are a lot of subtleties that we look at that in Western medicine we ignore. But little things like colors on the face, blemishes, the way you talk, the lips, the tongue,
Even the position of how you walk, how you sit.
the sound of your voice. We pick up on these subtleties, and all these come together because we have that holistic perspective. That we're looking at all this, trying to understand what's going on in the landscape of the body.
And part of what we're looking at is looking at the tongue. Now, I don't think this is unique to Chinese medicine. I used to remember old Tom and Jerry cartoons where they make jokes about coated tongues.
What was the joke again about coated tongues?
You know, they'd knock Tom unconscious and then he'd stick out his tongue and they'd make, oh, a coated tongue. And then the guy has a necktie and coat.
And
the tongue.
the tongue's there. The doctors say, what is it with the tongue? I know that you're looking out for teeth marks or maybe a color,
The
a
color,
different color to
texture,
the tongue. Yeah.
moisture. The idea is this is a piece of flesh that is a representative of the flesh within the body. This is a piece of flesh that can come out and we can see it. So taking from clues here, we have an idea of what's going on inside.
So just by looking at the tongue. And by looking at our tweet, let's check if he's a tongue-related question. Is it okay? From Andrew Enriquez, another tweet. Is it okay to mix traditional Chinese medicine treatments along with Western medication? Well, you mentioned that earlier, like for the cancer and stroke patients, that you do mix them.
Actually,
How would you answer that?
well, in this case, if by traditional Chinese medicine, he means herbs, I'm going to be perfectly honest and admit that this is why you need to go to a trained practitioner for herbs, because there is a big myth going on that just because something is natural, then
It's perfectly
It's
safe.
perfectly safe. It's a myth.
Okay.
The way I explain it to medical students is, look, if something is powerful enough to create a good therapeutic effect, then it's also powerful enough to cause harm if not used properly. So I remember studying in China, almost every other herb, it's don't mix this herb with this Western medicine. Don't mix this herb with this other herb.
antibiotics and-
Don't mix this.
Don't self-medicate talaga porque someone's
Yes.
using it and it works for that individual. It doesn't necessarily hold true it's going to work for you.
Exactly.
And what works is that we will have more on traditional Chinese medicine when we return. So when we return,
could
we
have
can
talked
talk
about-
about this. Yeah, we'll talk about it.
Aimed at maintaining the balance and harmony of qi flowing within the person. Aside from this, the practice of TCM involves the yin and yang concept, where two opposing yet complementary forces shape the world and are vital to life.
We're back on Medtalk and still talking about traditional Chinese medicine. We cannot let traditional Chinese medicine go without talking about, number one, acupuncture.
Acupuncture.
I love acupuncture. I'm an acupuncture addict, if I may say. I get it once a week.
Acupuncture is the primary treatment in traditional Chinese medicine. It's also the one that's most distinctively known as Chinese medicine. So here's a sample of the needles. This is a standard 1-inch needle.
Is that what all acupuncturists
Well,
use?
this is what we use on most parts of the body. You know, we have so many points all over the body, and this is the one that accesses most of the points.
Okay.
And it's the one that's primarily used because acupuncture is primarily used because it has the widest variety of treatments that it can treat. Treatment effects. With different points, we can treat different organs. With different points, we can treat the same organ but in different ways. We can upregulate, downregulate, make it hotter, make it colder. And depends on where we stimulate and sometimes how we stimulate.
So where we stimulate, I always hear the word meridians when we talk
Meridians
about
and-
acupuncture. What does that mean?
The Chinese system of anatomy, we see the flow of the energy. That the whole body is made of energy and matter, and some areas are more sensitive energy points, concentrations of energy. So these are the acupuncture points. And then they're located along the lines of qi flow, where the energy flows. So that's what the meridians are. If we stimulate them with needles, with cups, with heat, sa moxibustion, even with massage, or even with body work, qigong, yoga, tai chi, then we can make the qi flow.
So that's what acupuncture does. A lot of people get scared with the thought of a needle on top of their skin.
Why don't you
There's
show them
nothing to
just
be
how
afraid.
thin it is?
Will, yeah.
Okay,
So these needles are not hollow, not your hypodermic syringe needles. This is actually the plastic lang. So I don't know if you can still see it.
Yeah, maybe we can.
Actually, that's the point. You can't see it. It's that thin.
It's that thin. So it doesn't, and when we use it, we don't hit any nerves, we don't hit any blood vessels. We go through the skin, which is just a few millimeters thick. And so we don't actually get injured from the needle if it's done properly. And of course, as doctors, we also know there are forbidden areas that you don't puncture, like the eye, the nipple, and other sensitive areas.
Not worth of mentioning on TV.
But those that he has mentioned are the ones that you
It's a
can
bit common sense that you do not stick a needle there.
in your eye or in other sensitive areas. But in other areas like the meridians that you mentioned, you can stick a needle and it can, maybe needles can go up to 100, 200 depending on how many the patient needs, right?
That will depend on different acupuncturists because some acupuncturists like the more the merrier, and
Some are minimalist schools.
that would be
Okay.
me. In UP, I'm known as 4 needles or less.
Okay. So talaga you just zero in on the areas that need acupuncture, that need the balance
And it's much more
to
impressive.
happen.
Patient has a foot pain and then you put a needle in his shoulder and then suddenly the foot pain's gone. It's more impressive.
Okay. So again, in relation to that, you said
Because a
you
lot
put
of
it here, and in relation to the pain on his foot, why the shoulder?
You will
Because-
trace the channel, the meridian, the flow of the qi, and that's how acupuncture works.
there's a sorry.
So from one part of the body to another, from the outside of the body to the inside, affecting internal functions.
Because there's a common misconception even from patients that where it hurts or where the problem is, that's where you're going to needle. That is so far from the truth. In fact, if that were the case, why would we even bother studying all these pathways?
Exactly. And speaking of studying and bothering, I'd like to know more about the study of all these herbs in conjunction with acupuncture, in conjunction with, of course, traditional Chinese medicine. Maybe you can tell us all about the herbs that you have brought today, Doctor.
Yes, well, Dr. Kit has already started by talking about the meridians. In herbal, what makes Chinese herbal medicine, the science, different from others? Number one, Chinese herbal medicine also bases its theories on the same principles that acupuncture does.
Yin and yang, qi, flow,
And what about the 5 elements?
and 5 elements, and all the other ones.
Yes, 5 elements represent the organs, so each color. So sometimes just from looking at the color of a herb, you have an idea of where it goes. For example, this is my mandong or my mentong. My mentong is usually used for lung problems such as cough. Now, in Chinese medicine, the lung is associated with the metal element, which is associated with the white color.
Okay.
So white lung. They say this is goji berry. It's supposed to be, or known in local dialect as kamki. It enters the liver meridian, but in particular, it nourishes liver blood,
So that's
which
why
is
it's
hinted
Blood.
by its
It's
red
red.
color. The black color is associated with the kidneys. So this is shokte or shuti huang. It's the #1 herb for nourishing kidney yin,
Okay.
which in the kidneys are associated with the color black. So we don't mix the herbs randomly. I see a lot of people mixing herbs randomly. In Chinese medicine, there's a science behind it. Just like in acupuncture point
You
prescription.
don't just choose a needle, choose a point, and
You have to study it well and that it
You-
marries.
the point, yes,
together.
perfect wording. I've often said that Chinese herbs and even acupuncture, they're like a symphony orchestra. A particular part, a particular instrument, like the brass section, the string section, the wind, by themselves, okay, they kind of sound nice, but if a good conductor and a good musical piece can put them together, you make heavenly music. So I'll give an example, this one. This is the famous Si Wu Tang, or 4-substance decoction. It's the #1 herbal formula
For nourishing the blood. For young children, it promotes their growth. For women of menstruating women, it's good for the blood, reproductive
How is it
hormones.
taken?
Now, this is usually decocted. A decoction is when you boil something, you reduce the boiling water until it becomes like 1 cup. So you've extracted all the essential oils, and then you dispose of the solids,
And
you
drink
just
the soup.
Now, how did they come up with the with the formula? How do they put these herbs together? First, you have to nourish the kidneys. Since in Chinese medicine, blood is produced from the kidneys. The strength to produce blood. Of course, you have to eat and you have to breathe in oxygen, but the kidneys are the driving force. And then you have Chuanxiong, which is the #1 mover of stagnant blood. So you dredge the blood that's moving. Then you have Tangkui root, Angelica sinensis, which is the #1 herb that strengthens blood and also strengthens qi, so it moves the blood. And then finally, you have Bai Shao, which kind of regulates everything, but at the same time keeps you from losing blood. So you can see the main function of the whole formula is to nourish blood, but you can see how the different herbs team up with different roles. Some will strengthen directly, some will strengthen in the background, and another one will make sure you don't lose anymore.
Which is also very important, because a lot of other people just tend to mix all these herbs together depending on the suggestion of someone. Or maybe sometimes a suggestion of another doctor is coupled with the suggestion of another doctor, and they don't really understand what it's for. But this one we understand what it's for, because we have a question from Mark Luge from our Facebook page. Doctors, he asks, I've had chronic back pain and I've already tried physical therapy. A friend suggested I try going to an herbal doctor who practices alternative medicine. How will alternative medicine relieve my pain?
This is how I'll answer it. If you come to us, St. Luke's Complementary Medicine Service, we do all natural therapies. So maybe we'll do acupuncture first to relieve pain. There's probably some back spasm involved, muscular spasm. Acupuncture will help that also. If moving energies is not enough, then we'll have to move your matter. We have massage therapies there that will physically will manipulate the muscles and remove the spasms of the back. We have heat therapies that help that also. And then we'll prescribe a long-term yoga therapy, yoga sequence to help strengthen the back. So there's things that you do at the clinic, at the service, and then things that you can do on your own to help relieve the back. I'm sure that chronic back pain, so it didn't happen overnight. So the solution will also not be overnight.
And does it take longer for Chinese medicine to work?
It really depends. It depends on the cause. So Dr. Kit started with low back pain. Why are there so many possible modalities? Because there are so many possible causes.
So many factors to the problem, and we'll have to remove them one by one.
One by one.
Yes.
Okay.
It's not a one-time, big time that, okay, you have back pain, give you one thing to take, or one maybe modality of healing, and then
We're
it's
looking at the
gone.
landscape. You didn't come into this condition of chronic back pain just like that. Okay. But also, that being said, these things work very fast, amazingly fast, maybe even better than some of the Western therapies that we use.
Sometimes instantaneous.
I can attest to that.
In fact, I have a theory on why some people refer to muscle aches as lamig or hangin. Because literally, sometimes when you insert a needle into a swollen muscle, you can see the muscle immediately relax so fast, it almost looks as if a balloon deflating.
So it's that fast.
Yeah,
It can
instant.
be that
Depends
fast.
also, no?
But it depends
the
on
patient.
who's the one handling the needle.
Exactly. You should always go to a skilled acupuncturist. And again, your energy should be on the same frequency, possibly as your acupuncturist.
That
Let's see.
factors in.
That factors. That's an important factor, Dr. Kit. We have a question from our Facebook page from Sarah Fernandez. She asks, I've been suffering from allergies for a long time, And I know that too much medication has side effects. I've been doing research and I found out that I have the option of getting herbal treatment, diet treatment, or acupuncture. What do you think is best for me?
So this is one thing Chinese medicine is proud of because we deal with allergies better than Western medicine. Okay? Because it's a different outlook. We look at things as you are not in harmony with your external environment. So your internal environment is out of sync with the external environment. So we use acupuncture to balance that. Diet is also a factor. The chemicals, the foods that you put in compared to how it reacts with the outside. So that factors in. What about herbs? How will they use that?
The fun part is we have something here that's just for that. For example, you see this one. But before this, I'd like to ask, we mentioned allergies, but we have to be specific. Is it an allergy from stuff that you breathe? Is it allergy from something you touch? Does it manifest in the skin? Does it manifest as asthma? Does it manifest as a gastrointestinal problem? One of the best herbs that I know for treating skin manifestations of inflammation is this one. It's called chan tui. It's the shell of the cicada, after they molt, because insects molt.
Okay.
That's one interesting thing about Chinese medicine. If there's a problem with the kidneys or genitals, it's most likely a seed or flower. If it's a problem with the limbs, arms and legs, you might use twigs. So in this case, the problem is the skin, so you might use...
Do you chew on that? Or do you boil it?
You boil it.
I thought you were just going to chew on it. Quickly, before we go, ventosa. Just a quick, quick information on what it's all
Ventosa
about.
is basically a massage therapy, but it's a static massage. So it's not the hands moving, it just stays there for 5, 10, 15 minutes. And we use it as an adjunct for muscular problems, for skin problems, superficial. It doesn't go as deep, hitting the bone or ligaments or joints. So it helps a bit, but that's not the main thing. It's mainly for muscular and for skin problems.
It also helps to move the qi and blood. So in Chinese medicine, there's this theory called stagnant blood. For example, all of you here, I'm sure you've experienced black and blue marks.
Yes.
You get hit and there's black and blue, bruises. That can happen externally or internally. So cupping can help move that. And then also herbs like chuan xiong can help move that. Sometimes this bleeding though can happen, these blood accumulations happen inside. In gynecology, uterine polyps can be manifestations of blood or myoma. That's what for example, I brought that up because that's one thing that this herb does.
It helps with
it's
the
called
myoma.
the literal translation of the English name is fat of the 5 spirits.
Okay, what are these spirits?
It's actually flying squirrel poop.
Oh, okay, and that helps.
You don't take it directly.
I was about to ask if you take it.
It's part of a whole gaboodle of herbs to move that kind of blood.
Oh, you know what we can't do? Parang I just want to keep on talking and talking about, know, what.
I just had to bring that up.
I was curious. I was equally curious what it was all about. But, maybe we can have both of you again soon to talk more about acupuncture, ventosa, herbal medicine, and how, others may think of it as an alternative, or they can have it together with their Western practice, Western medicine. So I'd like to thank our guests tonight for enlightening us on the practice of traditional Chinese medicine. Thank you so much to Dr. Davao and Dr. Tangatue for joining us on the show. Kung hei Choy again, thank you very much. Join us again next Tuesday at 10 p.m. Our topic will be dental problems. So tweet us, post on our Facebook page, or send us an email and let us know your dental-related concerns. This is Angel Jacob for Medtalk. Thank you and good night.